Welcome to the Connecting Faith-Based Organizations with F.A.N. in Lancaster, South Carolina concurrent session. I'm Laurie Slade Funderburk, the Healthy Eating, Active Living Action Team Leader at Livewell Kershaw, and the co-chair of the Health and Wellness Committee at Littleton Street United Methodist Church in Camden, South Carolina. I am also a member of the Board of Directors of Eat Smart, Move More, South Carolina. Our goal at Livewell Kershaw is to improve access to quality health care and encourage the people of Kershaw County to take ownership of the health of the whole county, acting together to reduce chronic disease and obesity among the members of the community. At Livewell Kershaw, we have identified the F.A.N. program as an important way to spread the gospel of healthy choices and to educate and inspire by helping people make the connection between faith and health. The Health and Wellness Committee at my church adopted the F.A.N. program and have continued even through the pandemic to find ways to motivate the members of our congregation to better health. Engaging with faith-based organizations is a great way to change health outcomes. The University of South Carolina Prevention Research Center created the Faith, Activity, and Nutrition program to help churches create a healthy church environment that supports physical activity and healthy eating. This free, nationally recognized program has been implemented in more than 200 churches, with some of those churches located in Lancaster, South Carolina. Today's speakers are Dr. Sarah Wilcox from the University of South Carolina Prevention Research Center and representatives of the Eat Smart, Move More, Lancaster County, Ernini McCarthy, Dr. Zora Denson, and Kendra Riley. I hope you enjoy learning more about F.A.N. and how engaging with faith-based organizations can be beneficial to your work.
Well, good afternoon, and thank you all for joining our session today on connecting the faith-based organization with F.A.N. in Lancaster. As mentioned, the speakers for today, I am Kendra Riley with DHEC, and co-chair of Eat Smart, Move More Lancaster. We also have Irene McCarthy with Upper Midlands Rural Health Network, also co-chair of Eat Smart, Move More. Dr. Zora Denson, who is Director of Community Relations for the Town of Heath Springs and our F.A.N. champion, and Dr. Sarah Wilcox with the University of South Carolina Prevention Research Center. F.A.N., which is Faith, Activity, and Nutrition, is a faith-based health program. We had 4 churches in our area to participate in the F.A.N. program this time, and those churches are Bright Light Baptist Church, Mount Carmel AME Zion, Steel Hill AME Zion, and Total Restoration Ministries. Our learning objectives for today are 1, we want you to learn how to better connect with faith-based organizations in your communities. 2, we want you to gain a better understanding of the F.A.N. program and how to implement it in your communities. And 3, we want you to work around the challenges and barriers to implement a F.A.N. program. Before we get started talking about F.A.N., I want to give you a little bit of background about Eat Smart, Move More, Lancaster County. We are a subcommittee of Lancaster County Health and Wellness Commission. Irene and I have been part of the coalition before we were co-chairs. So before we became co-chairs, we did bike lanes and sharrows in downtown Lancaster and a pop-up farmers market. With those, we were able to work with our COG, Council on Government, locals, city and county representatives to put in bike lanes and ask people where they bike, where they walk. And so with that, we were able to put in bike lanes and sharrows in downtown Lancaster and also have a pop-up farmers market in the downtown area where people could walk or bike to that market. Recently, we participated in the Peace Training, which stands for promoting equity among communities effectively. That training talked to us about equity and including it in everything that we do as a coalition, and also respecting people's experiences in life. And so now we're implementing that into everything that we do as a coalition. We're proud to announce that Lancaster County now has a food share hub, and that was brought about through our Health and Wellness Commission and Hope of Lancaster. Eat Smart Move More has played a role of promoting food share for people to make orders, and also participated in volunteering at pickup and distribution days. Also new in Lancaster is the Lindsay Pettis Greenway. We have also had an active role in promoting the Lindsay Pettis Greenway and plan to do some activities on the Greenway to promote healthy eating and active living once it's safe. With the coalition and our coalition members, we were able to do a walkability assessment in Heath Springs. That assessment was brought about because of our different partners within the coalition. We were able to go to the town on a Saturday morning. We had a large group of not only community members, but also members from our coalition to participate. With that, we were able to walk 7 to 8 different routes and do a write-up that was presented to the city or the town council for improvements. Recently, as we all know, COVID-19 has brought about food insecurity and different things like that. So we were able to partner again with our Dr. Denson to do a food distribution in the town of Stonesboro. With that, we were able to assist in writing a 3.0 mini grant, and were able to assist with distributing the foods and having different partners. Dr. Denson reached out to the local food lion to bring about some meats. And so we had fruits and vegetables, meats and waters, and did a drive-through food distribution for the residents of Stonesboro. So all of this was brought through our events. All of our events came about because of the partnerships that we gained through Eat Smart Move More with Dr. Denson and also with Dr. Sarah Wilcox. And we just want to remind everyone that these connections start with trust and building relationships, and being able to successfully implement a lot of different things in your community. So now I'd like to turn it over to Irene to talk more about our F.A.N implementation process.
Thanks, Kendra. So I'm Irene McCarthy, as Kendra was saying, other co-chair of Eat Smart Move More Lancaster County. Talking a little bit about our implementation process of the program. So Kendra is absolutely right. It really does start with our community champion. It's completely essential. And so Dr. Denson was mentioned as our community champion. And we've actually had a relationship with her for a while. So she's been at the table for a long time because we've done so many other projects with her. So it really does start with that trusting relationship. And so we encourage you all to invite lots of, new people, different people to the table. That way you can have these established relationships when it comes time to implement different programs. So as a coalition, we all sat together and we discussed basically what we want to do next, as what's our next goal. So Dr. Denson and a few of the members said, we don't have a lot of faith-based organizations at the table yet. And that's something that we really want to create a relationship with. So we sat down, we intentionally looked at several churches that Dr. Denson and a few of the other members had good relations with. And we told them, okay, let's go ahead and invite them at our next meeting, get to know them a bit better, and then they can get to know us and what we do a little better too. In the meantime, we also researched a few different evidence-based interventions on healthy eating, active living that these churches could potentially implement within their church environment if that's something they want to do. So we want to have a few of those options readily available for them. We also created a health service. Can you guys hear me? Okay, sorry, I thought in the chat someone said they couldn't hear. We also created a health survey for the congregation, and the survey was including different things of like, what's your church environment like? Do you have wellness programs? Do you have support groups? And basically just trying to learn more about the church in general, and that could basically help us in the future as well when we create these relationships with them. So in January, we decided to send an invite to the pastors to join our February meeting, again, just to get to know them a little bit better and discuss this potential collaboration we could have. In the background, like we said, we did some research. And so we spoke to some of the members that went to a few of these churches, and they said, okay, let's narrow it down to F.A.N and faithful families, because they think they would be a bit more receptive to those programs, and they're really great programs. So it really comes down to what the church wants. It's not our program, it's whatever works best in environments. So we wanted to present those options and more information on it. So in February, we had our monthly meeting, and we had Dr. Sarah Wilcox come in and share about F.A.N. Tremise Carter came and she shared about faithful families. And so the pastors and some of the members were able to sit down, listen, ask questions, discuss the pros and cons of each program and what would best work for their particular church. And the majority ended up choosing F.A.N. And we think it's because it was so much broader, a bit more policy-oriented behavior change on a larger, wider scale for the congregation. So they thought that would work a bit best for them. So March came along, and as you all know, COVID hit us there. So we ended up taking things a little bit slower. Our priorities kind of shifted there. We wanted to keep everyone safe. We wanted to make sure people had the resources of the ever-changing COVID information that was happening at the time. We didn't know if meetings were going to stop or if we were going to put an end to this program or not. So we did want to still roll just in case we could. So we did develop a detailed F.A.N letter with more of that information we had discussed that last meeting. And we also sent out that survey to the pastors in their congregation by email. And I will say it was a bit harder to get in touch with them through email. We found it best when Dr. Denson reached out via telephone or in person. So just keep that in mind if you decide to implement, see what the best communication method is for you. And that's why having a community champion is so essential, really. So in April, Dr. Denson was still in touch with the pastors that had attended our meeting, and many of the churches had switched to drive-in style church. So no more in person just because of COVID. So it was good to keep in touch and learn what they were doing just to see if there's anything we could do to help on that end too, and sustain those relationships. In May, Dr. Denson had been in touch with those pastors still. Do you see a pattern here? This is why she's essential. So she was in touch with those pastors still, meeting with them. And we actually had a few more churches say, hey, we want to be involved with this. So she was keeping that momentum. She was attending those meetings, those calls, those church services via drive-through style. And then she was also providing them a heads up on, we will be having eventually online F.A.N training, which would be the first time as well. So in June, we had a few more churches hear about us and say, okay, yeah, we kind of want to check this out. And so Dr. Denson said, since we're getting some new people at the table and the training is starting soon, why don't we go ahead and host an orientation for the pastors via video call sometime mid-July, just to reiterate what F.A.N is, to add more information, and then give them that heads up that online training will be starting September, October timeline. Next slide, please. Okay. And then in July, we had our F.A.N orientation for pastors via Zoom. We did not have all 15 churches. There were a few. Keep in mind, during COVID, priorities change. Some pastors, we had a lot on our plate, and people, things change, and so they couldn't make that first cohort. They might make our second or our third cohort. And so we did have a smaller group, which that's okay. It still turned out, amazing. So we had a few less people join that meeting, but the ones who did join, they did commit to it and they were ready to roll. So in August, we sent the next steps for the pastors. They had to fill out interest forms through the F.A.N programming. And then that first cohort would begin on August 24th. Online training would begin early October. It was supposed to be sometime in September, but it was the first time doing it online, so we had to make sure everything was up and ready and rolling. So it started a little bit later, which is fine because we had to get those interest forms in anyways. So if churches didn't meet those deadlines, then they would have to be a part of the next cohort, which would have begun January 2021. In September, we as an East Smart Move More, with the help of Dr. Sarah Wilcox, we drafted some letters of support for the churches and did some final prep for FAN training. So the letters of support were just kind of sending them out to the pastors, again, through Dr. Denson. She mailed them or hand delivered them, not through email, just we wanted to make sure they received them. We wanted them to let them know that East Smart Move More and USC were here to help. If there's anything we can do throughout their process, prior to training, during training, after training, we're here. This is our contact information. This is what we do. And so we just wanted to reiterate that for them and, keep that relationship going. In October, the training began. We sent those letters out, and the training, kept running through November. Everything was going great. And then in December, we had 6 trainees from those 4 churches completing their FAN online training. A few of them attended our meeting afterwards and provided some feedback on their general experience, what they liked, what they didn't like, what they were excited for. And so it was really great to have that feedback. And then in January, East Smart Move More sent out congratulatory letters to pastors and the congregations who completed the training, saying, thank you so much for completing this. We're excited for the next steps. If there's anything you need, we're here for you. We also embedded some resources on, COVID, on the Lindsay Pettis Greenway, any other kind of local community resources that would maybe help them in the future in their implementation process. So we can align those resources and those community partnerships as well. Next slide. And then these are a few materials and resources we use throughout. So if you see on the left-hand side, this was our orientation Zoom meeting, little flyer. And we also had the letters of support memo, the congratulatory memo. And then USC has some great resources and materials online that we utilize. So they be a fan for your church's health. They have a great amount of flyers and pamphlets and different things that you could share on social media or, through email or, just print them out and send them to the churches at health fairs. So definitely use them as well. And now I will go ahead and hand it over to Dr. Sarah Wilcox, talk a little bit more about FAN.
Great. Thank you, Irene. Good afternoon, everyone. I direct the Prevention Research Center at the University of South Carolina, and I also am leading the FAN study. You've heard a great overview of how Eat Smart, Move More Lancaster and the churches in the county came together and kind of went through a process and chose FAN. And so what I'd like to do is just take a few minutes to tell you a little bit more about the program and what it entails. The overall goal of FAN is to support churches to create healthier environments for physical activity and healthy eating. And it really takes, as Irene mentioned, a policy systems and environmental approach. FAN was originally developed in partnership with the African Methodist Episcopal Church in South Carolina. And so we partnered with the AME Church to develop FAN, to implement it, and to evaluate it. Based on its favorable impact, both on member behaviors as well as on church environments, we went on to test FAN in more diverse denominations across South Carolina in a dissemination and implementation study. It was first offered to all churches in Fairfield County, and I will say very similar to what Irene emphasized throughout with having a community champion. We had a similar type of community champion in Fairfield County, and it really is critical. And then it was offered to all churches in the South Carolina Conference of the United Methodist Church. We currently have CDC funding to do a national implementation study of FAN that uses an online training platform. That was a pre-pandemic decision, but turned out to be probably one of our best decisions. So FAN is really a flexible program. It is grounded in Christianity, and churches are supported to increase opportunities for physical activity and healthy eating, especially before, during, and after church events, because we really want to reach everyone in the church. It supports churches to share health messages through familiar church channels like bulletin inserts, announcements from the pulpit, and things like that. It engages church leaders. It helps the committee learn how to engage church leaders in the F.A.N goals and to support the health of the church leaders. And finally, F.A.N supports churches in setting guidelines or policies for physical activity and healthy eating. So it might be things like a policy saying that at any church event with food, it would include a fruit or a vegetable. So during their training, churches receive a lot of ideas and suggestions, but ultimately they choose activities in each of the 4 areas that they think will work in their church. So it's not a curriculum that you have to do X, Y, and Z. The F.A.N program has developed a supplement with COVID-friendly activities so that churches have some ideas for things that they can do right now, even if they are still meeting virtually or in some hybrid model. So the way that the training works is that churches form a committee. We suggest 2 to 5 members, and they identify a F.A.N coordinator, someone in their church that will lead or coordinate the efforts of the committee. The committee then completes the online training to learn how to put F.A.N into place in their church. And we emphasize that members can do the training on their own and then kind of come together to talk about what they want to do, or they can do it together like as a small group and do the training together in the same room or even virtually online together. The online training includes 8 weekly and interactive lessons that are self-paced. It includes a discussion board where churches can share their successes and their challenges with other churches that are going through training at the same time. And it also allows our F.A.N staff to post reminders and other helpful information. And then there are 12 months of resources to really support churches in putting the program into place. And you can see some examples here on the slide. And they're all housed kind of in an online system. During the training, the church committee begins to develop a 12-month plan for what activities they would like to do, who's going to lead them in their church or be the point person, and when they will start the activities. As they finish the training, we ask the churches to kind of finalize and submit the plan, because we're really seeing in our research that churches that do complete the plan are much more likely to implement the program. And I just wanted to share an example of an interactive element of the training lessons. So the F.A.N training includes examples of physical activity breaks that churches can build into their meetings and events. And so this video demonstrates the gospel liftoff. It's a 10-minute activity break, and I have about a minute to show you. As you heard in the beginning, feel free to get up and move around and take a little break here. No. We've been sitting for a long time. Who's up for a gospel liftoff? Oh. Let's do it.
All right, it's time for a gospel liftoff. Let's start marching in place. Left, right, left, right. Ah, that's too slow. Left, right, left, right, left, right. There you go. We're gonna stomp out a message for Jesus tonight. Just want you to march, get your body warmed up, feeling good, and you're looking good. All right, now we're gonna do a shoulder press. We're gonna lift our hands up behind our heads and just go up into the air. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Give it praise. 1, 2, 3, 4, 5, 6, 7, 8. All right, march in place, march it out, march it out.
All right. Okay.
Writing's not that easy, but
Sorry.
Grammarly can help.
the downside of YouTube, I guess. Okay. All right. And I'm going to turn it back over. Oh, yes, let's see. And Dr. Denson, if you can go ahead and unmute.
You to hear me. Thank you, Dr. Wilcox. Can you hear me?
Yes, just speak a little closer to the microphone a little bit.
Can you hear me now?
We can hear you a little bit better.
Okay. Good afternoon, everyone. As Director of Community Relations for the Town of Heat Springs, I bring you greetings today. And I am not wearing an S on my chest. I am an advocate for F.A.N. I bring you greetings on behalf of each faith-based entity that has adopted and implemented the F.A.N program in their respective churches in this area. And if they all could be here today, they would express firsthand how much F.A.N has influenced the health and wellness mission of their community. You have been given a description of F.A.N and its origin. As a community advocate for the program, I am very excited to share how F.A.N has actually been walked out in the Heat Springs, South Carolina, and Lancaster area. Even during COVID-19, churches have found creative ways to press through the pandemic. I invite you now to travel with me as we journey through the process, through this F.A.N process. Once the needs assessment surveys were created, sent, and collected, area pastors selected a member from their church to serve as a leader. Pastors selected one of the health conscious parishioners in their congregation. This could be a nurse, a healthcare worker, someone in the church that is part of the Nurses Guild, a healthcare team member, or anyone who displays a concern for health. And remember, there's always one in the church's community who fits that profile. So look for that person. Once the committee members or leader was determined, invitations were sent and promotions began. Members met for an introduction and an overview of the F.A.N program in the middle of the pandemic. The online training began in October 2020, as you have heard, and for 8 weeks, committee members met with their masks, laptops, gloves, and logged on to their personal ID numbers that were given by the University of South Carolina. We met in groups, and that made it easier and a little smoother for us. The sessions were treated as a Bible study, opening with prayer, discussions about their health, and using the university's guiding scripture, 3 John verse 2, beloved above all things, I wish that you would prosper and be in good health, even as your soul prospers. Those members who were unable to physically come out, they worked or joined online at their own pace, as you've heard from Dr. Wilcox. The lessons included how to have a church-wide engagement, healthy eating during church events, no more fried foods or minimum, selecting foods that fit more categories of fruits, vegetables, and water intake. Another lesson was designing church policies and publicity for health and wellness awareness. And with any process or any new program, some challenges did come about in maneuvering online. And for those who are not fully computer savvy, help was on the way. But the excitement to continue with the training outweighed all of our circumstances. Our churches plowed right through and were not left to navigate alone. The University of South Carolina's technical support system was phenomenal. I want to thank the university for that. Whenever there was a bridge to cross, they were there to guide our hands literally. And because the lessons were interactive, I think this alleviated a lot of the fears. A sense of accomplishment was achieved in December, yay, right about Christmas time, it was our gift. An 8-week training program had come to an end. And the next step was how to creatively design a way to implement all of the wonderful training that would be the plan. So due to our limited in-person worship, we had to think of ways to do that. But we were not limited in person because of in-person worship. We were not limited with implementing. And so what happened, members decided to create an online support system where we were able to send out recipes, home exercises, tips on walking, food accessibility, and restaurant dining. All of these resources, as you have heard, are in the online training. Everything that was needed to accomplish is in the online training. F.A.N was supported very heavily by pastors. It's very important to have your pastor on board. Pastors from all denominations came together as one body to demonstrate how we're to take care of the body. And getting pastors on board is critical. We can't stress that enough. The 5 churches who completed the training decided to kick off F.A.N together. And what a grand kickoff it was. I believe you have that slide, Irene. The kickoff, there we are. The kickoff was wonderful. What a grand kickoff it was. Just last weekend, 50 participants came together to kick F.A.N off and to invite other churches to participate. We had exercise, walking, chair exercises for people who could not do the walking, and for the churches to hear more about the program. And they signed up to commit to coming on board with the next cohort group. It was a great day. So let's talk a little bit about the evidence of success. F.A.N really is changing the health landscape of our churches in this area. We can see evidence of more health consciousness, collaboration between denominations, and changes in church policies to fit and to make sure that healthy eating is done. Eating smarter at home, making more choices, healthy choices, and having youth engagements, making it a practice to move more. A better understanding that faith and the physical health connection is possible and should be demonstrated in our daily lives. The F.A.N program really does work if you work it, and it is worth a try. We incorporated faith, activity, and nutrition, and it's a win-win for any faith-based organization. I encourage you to become, not practice this all day, a F.A.N for your church's health. In conclusion, I would like to say that the inclusion of God's word, 3 John verse 2, which admonishes us to prosper and be in good health as our soul prospers, serves as an inspiration to be a better steward over our bodies. So feel free to incorporate scripture about health when you're doing the F.A.N program. Here you have some testimonials, and as Dr. Wilcox indicated, throughout the county or countywide, there's an opportunity to share together. A community of countywide F.A.N participants can share online as to what and how they feel. And these testimonies, for the most part, were positive, a lot of positive feedback. They were saying that we're happy to be a participant. We can't wait to try some of these strategies, and we want to personally invite others to do so. So they're making changes and small changes in their homes. Regarding the outcomes, I want you to know to be prepared to see changes. We've seen the changes in our area, so be prepared to see the changes that we have in food selections, attitudes, and behaviors. So the takeaway I would say today from this conference or from our portion is, I urge you to be a committee of one. Go back to your churches and your community and be a F.A.N for better health. Be a F.A.N for better health. Thank you so much.
Great, thank you for that. That is just wonderful to see it come alive in the community and in the churches. you heard from Dr. Denson some of the outcomes that churches were covering. Am I to cover this part, Irene? Okay. And I just wanted to note some other outcomes that we've seen before COVID-19. So I mentioned the work that we've done in Fairfield County, and in fact, 40% of churches in the county adopted F.A.N and were trained, and about 12% of all churches in the South Carolina Conference of the United Methodist Church. F.A.N has resulted in meaningfully large changes in church practices. So we're seeing churches putting in more opportunities, guidelines or policies, messages, and pastor support. And we have also, in our last study, been able to follow churches for 24 months, and we're seeing that changes are generally maintained. And I think it's because they are making changes to kind of the fabric of their culture and practices and policies. And it's not just a program that gets put in for a few months and then, you know, goes away. But they're really learning to make sustainable changes.
Thank you, guys. And in closing, we just want to reiterate our 3 goals again. One being learning how to better connect with faith-based organizations in your communities. Please, it is crucial, have that community champion at the table, you know, prior to F.A.N, have them at the table so you can have that relationship already established. Another thing to note is F.A.N is the church's project. It's not ours as Eat Smart Move More. We're here as a supportive role. We want to be able to be open and receptive to their ideas, learning more about the church and their dynamics, and assisting in any way we can. But ultimately, it is the church's project, and the congregation members and the pastors are the ones who, you know, should be at the forefront, really involved. And then another thing, just inviting those pastors and other congregation members to our meetings and events that are not just F.A.N based. So allowing them to be involved in other projects aside from F.A.N, just to, you know, offer, you know, help sustain those relationships, but to also offer crucial community input we want from them in other areas need. Our second goal is to gain a better understanding of the F.A.N program and how to implement in your communities. Make sure that F.A.N is the right fit for that church in your community. Sometimes it might be a different, you know, project altogether that may work better for them, but you won't know unless you invite them and you talk to them and you have them choose what would be best for their church and their dynamics within that church environment. So really including them every step of the way is critical. Working with USC to obtain appropriate resources, technical assistance, USC was very helpful throughout the entire process. So of course, working with them every step of the way is critical as well. And our third goal, working around challenges and barriers such as COVID in our case during implementation. We want to make sure that we're working with other community partners so we can align these resources that will make F.A.N implementation easier and make things easier for the church as well to be supported. And then also being flexible and innovative when it comes to assisting the church with their desired policy, implementations, and changes as they maneuver what is best for their congregation. Next slide. And that is all we have. We just want to give a big thank you to Eat Smart Move More Lancaster County members and to the churches in Lancaster County who are taking part in F.A.N. If you'd like to learn more about F.A.N and enrolling for the F.A.N online training, here is a link below. And at this time, we will be taking some questions. And this is our contact information as well, if you'd like to contact us directly with any questions or concerns. Thank you all.